Concerns raised about India's contact tracing app. India's contact tracing app, Arogya Setu, has reached over 100 million users in only 41 days. The app, supposedly used and not just downloaded by a big chunk of India's 450 million smartphone owners, has users answer a few questions to determine if they have COVID-19. The app then alerts people who have come in contact with them in case they are infected. Arogya Setu means healthcare bridge in Hindi, informing users of the country's testing efforts and tips regarding the virus. Once voluntary, it is now mandatory for all public and private organizations returning to work and anyone traveling with Indian Railways. However, privacy advocates and security experts have raised concerns about the app, including its storing of location data and its source code not being public. Countries across the world have been rolling out either voluntary or mandatory contact tracing apps, with the first few apps coming from Asia. Several apps use data from checkpoints in China, while South Korea sends out mass cell phone alerts to inform citizens about where infected patients had been. Some states in the US have developed Bluetooth apps, as Hong Kong and Taiwan officials use GPS and Wi-Fi. Many contact tracing apps use Bluetooth tracking with encrypted identities to safeguard privacy, but Bluetooth can also churn out false positives because the signals can travel through walls. Though 5.7 million people have downloaded Singapore's Trace Together app and 2 million have downloaded Australia's COVID Safe app, authorities say that isn't enough of the population for the apps to be effective. Laurie Clark of NS Tech, the new tech division of the New Statesman magazine, says critics are afraid governments and companies may compile databases of users' activities and expose them to privacy breaches. Although contact tracing apps exist to protect public health, it is possible that they may be used to also track those who express dissent. Bloomberg opinion columnist Andy Mukherjee warns, where boundaries between private and public are thin to begin with, a pandemic can make them disappear. The Indian government continues to back the Arogya Setu app, but doubts about it remain. Rajya Sabha, a member of Indian Parliament, raised 7 points in his article for the Indian Express, saying, if instances of misuse of the Arogya Setu app emerge, then people will not trust other government initiatives involving health records. Contact tracing is a crucial part of each country's fight against COVID-19, but it is clear the apps must be created with privacy and possible long-term consequences in mind. Would you allow your data to be accessed by a contact tracing app? Share your thoughts with us in the comments below.